Okay guys, so I want to make this video about why more doctors should consider doing RPM and CCM programs. So in America we have a overabundance of patients needing care and a lack of access to that care. And physicians see patients, this is ambulatory care. Physicians see patients in the outpatient setting, and for the most part, they perhaps, if they're the primary, they do a physical. If they're not the primary, they do a consultation and maybe a follow-up visit. But that practice is really loosely managed when it comes to the follow-up and follow-through, and not by design, I'll give them that, but it's just by the sheer volume of patients that come into the practice. And are those practices able to follow up and follow through on some very fundamental things? They wrote a prescription, they requested some labs. That's if the labs weren't drawn in the office, which a lot of them are not. And so they put all this stuff in their treatment plan, or the P for plan in the SOAP note, and there's really not any singular person or team of people that are taking on ownership and responsibility for following up with that physician's plan. They don't have the capacity, nor for the most part do they have any additional licensed people in that practice that is capable of following through from a license perspective. They're medical assistants, basically a made-up type of certification in each state that says they can assist in the practice, but there's no real certification when it comes to the county or the state. It's basically something that is like they've gone through some basic job training, or they're a office administrator, and there are some certifications for that, but there's no real oversight, and it's not like a regular license. It's not something that's they have to get CEUs, they have to stay up to date on what's happening with our laws and legislation to ensure patient care gets rendered properly under the different codes and titles. There's none of that, okay? So, like a license, we're all, in California, we're all under Title 17 and Title 22, and these official guidelines about how care needs to be rendered. So they fall outside of that. The only person that's legally at risk is that physician. And if that physician doesn't follow up and doesn't really know about the follow-up, they just kind of fall by the wayside. And another year, 2 years go by, and he comes back or she comes back to that physician for another physical or another consult, and that physician might ask, hey, I asked you to do some labs or pick up this medication. Did you follow through? Because I'm not seeing the labs, and as a matter of fact, I'm not seeing anything showing that you actually received the medication. And that's another thing. We prescribe medications on e-scripts and all scripts and all this stuff, but there's no bilateral communication to the medical record that that patient is picking up the medication, unless it's some type of mail order. But that's where they drop the ball with, another place they drop the ball with EHRs and making sure that there's a full loop of validation with everything. So I want to take you from there to remote physiological monitoring, or RPM programs, remote patient monitoring programs, or CCM, chronic care management programs, and why we should be really pushing towards some type of legislation to have this stuff in place. CMS has made it a point to include CPT codes that are reimbursable when a patient has Medicare Part B, and even some Medicaid plans or Medicaid billing codes do provide reimbursement for that under the different states. Not all states, but some states. So, by and large, we have patients that are not getting follow through and follow up, and having them engaged with an RPM or CCM program would ensure that this follow up and follow through of the plan, the treatment plan, is rendered, along with a nursing care plan and other things that go into that, the SMART goal and everything else. And if we did this, I assure you, we would have better outcomes than we have today. And I will leave it at that. Thanks for listening.